Robert Gagne was an American educational psychologist best known for his landmark book, Conditions of Learning, his co-authorship of Principles of Instructional Design, and his instructional theories and design models, most notably the 5 levels of learning, the 8 hierarchical categories of learning, and the 9 events of instruction. This presentation will explore in detail Gagne's 9 learning events based on his theory of instruction and how it would benefit the planning and construction of my future online course regarding compassionate care. Robert Gagne presented a series of 9 instructional events that became the foundation of cognitivist instructional design. They are: gain attention, orient the learner, stimulate recall of prior knowledge, present content material, provide learner guidance, elicit performance practice, provide informative feedback, assess if lesson objectives have been learned, and enhance retention. The following are ways Gagne's 9 events of instruction can be applied to an online lesson. The first event, gain attention, the mental process engaged is perception. The online lesson should include a hook that immediately draws the learner in. Ways to hook a learner are: excite the learner with a shock factor to motivate, present a new problem, situation, or question, asking what if, use multimedia such as a short video or audio clip, present a quote, something controversial, or an analogy, create a demo, use icebreaker activities, and/or include surprising statistics. In my online course regarding compassionate care, I plan on including new problems, demonstrations, and statistics to hook the learner's attention. In the second event, orient the learner, the mental process engages expectancy. This is where lesson objectives are described. The lesson should also explain in detail what it expects the learner to do and how the learner will be assessed. Objectives must be measurable and observable. In my online course, there are 4 learning objectives regarding how caregivers can identify and practice compassionate care. Their knowledge will be measured and observed using short, ungraded knowledge checks and a quiz at the end of the lesson. In the third event, stimulate recall of prior knowledge, the mental process engaged is retrieval of working memory. Here, the online lesson may ask the learner to discuss a related personal experience, brainstorm ideas, or give them a situation to develop possible answers from a previous situation. The online lesson may quiz learners on previous knowledge or present a scenario. What is known serves as a connection to a new topic. In my online lesson, I plan on incorporating scenarios to illustrate on how compassionate care is woven in a caregiver's daily patient care practice, providing a connection to their own personal experience as a patient care provider and a link to what they've already learned and experienced. In the fourth event, present content material, the mental process engaged is selective perception. The online lesson provides the content material to the learner in a way that will enhance learning. Some of the best ways to do this are by breaking material into small chunks, simulations, lab or demonstration, activities, projects, multimedia, and graphics. In my Compassionate Care online lesson, I plan on chunking the course content, including graphics and possibly multimedia depending on the length of the training. In the fifth event, provide learner guidance, the mental process engaged is semantic encoding. The online lesson can apply strategies so that the learner can absorb the new material, such as provide sample problems and scenarios, include group discussions, allow for guided practice, highlight common mistakes and pitfalls, and add rubrics and study guides. In my online lesson, sample scenarios will be used as the foundation of the instruction. Knowledge checks will serve as a way for learners to engage in guided practice where common mistakes and pitfalls are addressed. In the sixth event, provide learner guidance, the mental process engaged is responding. The online lesson can provide opportunity for the learner to perform skills that were defined in the objectives through group collaboration, labs, individual and group projects, activities, or multimedia practice. For my online lesson, I'm envisioning an individual project where caregivers post an example or story of how they provided compassionate care to a patient that would be posted on a visual board. In the seventh event, Provide Informative Feedback, the mental process engage as reinforcement. In an online lesson, this is where we make learning stick by providing transitions to apply information in other settings and through peer and instructor feedback. It is best to give specific feedback of where the learner did well and the areas that need improvement versus a generalized statement of "good job." In my online lesson, I plan on leveraging knowledge checks and a quiz for feedback, as well as a student survey at the end of the lesson. In the eighth event, Assess if lesson objectives have been learned, the mental process engage is retrieval and reinforcement. The online lesson should include assessments to determine if the objectives have been met by individual learners. Examples are student presentations or performance incorporating what they learned, a creation of a particular product, and/or a written assessment. For my online lesson, I plan on using assessments such as knowledge checks, a quiz, and a survey to measure the achievement of lesson objectives. In the ninth and final event, Enhance Retention and Transfer, the mental process engages retrieval and generalization. Learning should be reinforced through the review of additional examples and applying information in other settings, relating objectives to personal experiences, including labs or demos, providing a debrief of what has been learned, summarizing the content and application to a new situation, and giving the learner a new situation to identify the transfer of knowledge. For my online lesson, I'm including additional examples, a connection between the material and the caregiver's experience, and a summary of the content. Gagne's 9 learning events provides a solid foundation to the planning, design, and execution of my online lesson regarding compassionate care directed to patient care providers. By gaining the learner's attention, providing clear objectives, stimulating the recall of prior knowledge, presenting content in a structured, palatable fashion, providing guidance, eliciting performance, providing feedback, and enhancing retention and transfer, by revisiting an elemental area of patient care with a fresh approach, will hopefully foster employee engagement and improve the patient experience at my healthcare organization.